Top 15 FAQs by coronavirus experts. The coronavirus keeps causing havoc around the world, particularly in the United States, as tens of thousands become infected and hundreds continue to die every day. Few still question whether or not the pandemic is real and are starting to ask more pressing questions about the disease out of fear of contagion. Why some people die? Which blood type is at a greater risk of catching the disease? How long will we be wearing face masks? Those are just 3 out of the 15 frequently asked questions we'll be answering in today's video, based on experts' opinions. But before we get started, please take a moment to give us a like, subscribe, and hit the notification bell for more videos. Number 15. How long will we be wearing masks? In short, until we either find a cure, find a vaccine, or reach herd immunity. But how long will this take? Well, there are 3 things to consider. 1. We really haven't found a cure for any virus, even for the common flu, so it's unlikely that we'll find one for COVID-19. 2. There still isn't a working vaccine, and the ones that are being tested today are still in the early stages of clinical trials, so we won't see them rolling out before mid-2021 if we're lucky. 3. In order to reach herd immunity without a vaccine, an estimated 70% of the world population has to become infected and recover, which could take years. Fact is, we'll have to live with face masks for at least 1 or 2 years in the absolute best of cases. Number 14. Why do some people die from COVID-19? It's still too early in the game to really know for sure how COVID-19 kills. However, most deaths so far have been caused by 3 major mechanisms. 1. Coronavirus patients are prone to developing blood clots. When these clots reach the lungs, you suffocate and die. 2. The same blood clots can also cause strokes when they reach the brain, in some cases killing the patient. 3. A condition known as cytokine storms, which is an immune system in overdrive, causes inflammation in many organs, including the heart, literally making it burst. The first one is a silent killer. A blood clot in the lungs causes your blood oxygen level to drop to a point that you are technically dead while still appearing perfectly fine. This is a condition coined by doctors as happy hypoxia. Many people have very pressing questions about this disease, and some of the most common are related to known risk factors. Keep watching for the most important ones. Number 13. Is COVID-19 deadlier for men than for women? Yes, it is. COVID-19 has so far killed many more XY genetic males than XX genetic females. In some countries, almost 4 times more men have died than women, which naturally brings up the questions of whether men are more susceptible to the disease. However, statistical analysis shows that this difference isn't really related to differences in our body, but mostly to underlying risk factors, cultural differences, and behaviors that are more common in men. But in any case, if you are an XY male and you catch the coronavirus, it is most likely that the disease will kill you than an XX female. Number 12. Does having AIDS make you more susceptible to the coronavirus? It depends on taking your antiretroviral treatment or not. You see, people who have their immune system compromised are, in general, more susceptible to any infectious disease, including COVID-19. So it's clear why many HIV patients are more than a little worried about the pandemic. However, if you've been taking your antiretroviral treatment, odds are your immune system will be just as fit to fight the coronavirus as anyone else's. Just don't go out taking any chances. Number 11. What is multisystem inflammatory syndrome in children? And what does it have to do with COVID-19? So, it's common knowledge today that age is a huge risk factor for COVID-19, and that children usually recover quickly and without many problems. But some children do develop complications, such as the multisystem inflammatory syndrome, in which a hyperactive immune system starts targeting their own cells, causing inflammation in different organs at the same time. This is a very dangerous syndrome and can be deadly, so it's still something to worry about if your kid contracts the coronavirus. Number 10. Are pregnant women more susceptible to the COVID-19 virus, and will it harm the fetus? For once, to-be mothers are spared. there doesn't seem to be much evidence to suggest that they are more likely to catch COVID-19 or to suffer worse symptoms than the average person. However, even though there haven't been any cases of mother-to-child transmission in the womb, there have been reports of miscarriages and reduced blood flow through the placenta to the fetus, which could cause severe damage to the unborn child. Number 9. Does blood type matter for COVID-19? Yes, it does. Those of you who have blood type A or AB plus or minus, raise your hands, because you're a lot more likely to catch coronavirus than the rest of us. Type Bs seem to show average levels of contagion, but if you're the proud carrier of blood type O-, bring out the confetti because you're up to 67% less likely to get COVID-19. That doesn't mean that you won't catch it though, or that you'll be better off than the rest if you do, so don't go ditching your face mask just yet. Number 8. When should I get tested for COVID-19? We shouldn't seek to get tested for COVID-19 out of a whim, but there are a few scenarios in which we definitely should. 1. If we have any flu-like symptoms, including a cough, frequent sneezing, and a fever. 2. If we've been in contact with someone who has tested positive. 3. If we arrive from a trip to a place where there is an active outbreak. If we don't have any symptoms and we don't fit these descriptions, it's likely not a grave concern whether to get tested. After all, you can be tested negative in the morning and still catch it that same day later in the evening. Number 7. What should I do if I get sick or someone in my house gets sick? First, stay home. Don't go out in public, and if possible, wear a mask even inside to avoid potentially spreading the disease to your family. Second, notify your closest healthcare center and get tested right away. It'll most likely be a common cold or flu, but it's important to be sure. Third, isolate yourself from others in the house and make sure that you all ramp up your disinfection protocols around the house. Fourth, don't self-medicate with antibiotics. Those kill bacteria, not viruses. Fifth, if you can breathe fine but feel shortness of breath, or if the symptoms become too severe to withstand, go to the nearest hospital. Some unscrupulous companies have tried to take advantage of people who are already sick and afraid of dying. You won't believe some of the products they claim will cure us. Number 6. Will Miracle Mineral Solution MMS cure COVID-19? For heaven's sake, no! Unless you consider dying a cure to COVID-19, do not take MMS. That's basically industrial bleach and will literally burn your insides, causing vomiting, diarrhea, and life-threatening dehydration while not freeing you from infection. Yeah, it'll kill any virus particle in your digestive tract, but it won't reach your respiratory tract unless you decide to go stupid all the way and inhale it, in which case coronavirus is the last thing you'll have to worry about. Another thing most people want to know is when all this will be over, so naturally, many questions about transmission and the end of the pandemic arise. Keep watching to learn more. Number 5. Can mosquitoes or ticks spread the coronavirus? It's a scary thought, but no. It's very unlikely that you'll get COVID-19 even from a blood transfusion, so being bit by a mosquito that had previously bitten an infected patient won't pass it on to you. That's why blood banks don't even require donors to test for COVID-19 before donating blood. Thankfully, mosquitoes or ticks can't even transmit HIV or many other bloodborne diseases, so there's nothing to worry about. Number 4. Will warm weather stop the outbreak of COVID-19? You don't need to be an epidemiologist or a doctor to know the answer to this question. We all saw how the outbreak exploded all across warmer southern states in the US, right when summer started instead of dying down, so the answer is no. However, even though there are countries where the spread is mostly under control because it's summer, we have to remember that it's not just because it's summer viruses are under control. Number 3. Can people who recover from COVID-19 be infected again? Yes, they can. You see, becoming immune is not a simple one-step process. That's why it's so hard to make vaccines. There have been many reports of reinfection so far, but whether this new infection was caused by the same strain that caused the first onset of the disease or caused by a new, more aggressive strain is yet to be determined. In any case, it's still unclear whether catching the virus the first time grants immunity at all, or for how long. Number 2. How long will vaccines protect our bodies? There's no way to know for sure at this point. For starters, because we don't even have a working vaccine yet. However, findings suggest that one exposure to the virus may not grant enough immunity to prevent a second infection. But there haven't been any reports of a second reinfection, so it's possible that we can develop immunity after a second shot of a potential vaccine. We won't know how long this immunity will last, but we don't need it to last forever, just long enough for us to be able to control the pandemic. Number 1. When will we have a vaccine for COVID-19? Even if the most promising candidate vaccines that are currently undergoing clinical trials succeed, we still won't see them roll out any earlier than mid-2021. If they fail, on the other hand, it could be more than 1 or 2 years before we manage to find it. However, we should consider the possibility that we don't find a vaccine at all, since we still haven't found one for the first coronavirus that caused the SARS pandemic, and that was more than 17 years ago. Do you have other questions about COVID-19 that you think are more important? Which question or which answer surprised you the most? Leave us a comment down below and join the discussion. We'd love to hear from you. While you're at it, please remember to hit the like and subscribe for more videos. Thanks for watching.